My name is Caitlin Palachek, and I am with Cook County Health. Thank you for joining us. If you need help with an appointment or have a medical question, you can reach our health system at 312-864-0200. That's 312-864-0200. My guest tonight is Dr. Sharon Welbel with Cook County Health, and she's the chair of infectious diseases. Welcome to the show, Dr. Welbel.
Thank you.
So first of all, can you tell me a little bit about yourself and how long you've worked with the health system for, and what does your role entail?
Absolutely. And thank you for having me. So I trained at the Centers for Disease Control and Prevention after my infectious disease fellowship.
Okay.
I trained at Michael Reese and University of Chicago. And really right after that, I came to what was then called Cook County Hospital. And that was 23 years ago. So that was a while ago. I was actually pregnant with my first child.
Wow.
I'm actually the chief of hospital epidemiology and infection control.
Okay.
Dr. Schwartz is the chief of infectious disease. So at Stroger, now what I do is I basically develop all of the programs to prevent hospital-acquired infections. So, you know, I write them, we figure out how to maintain them and implement them and change them as needed to make sure that nobody at the hospital is getting infections. But also, I make sure that when there are communicable diseases in the city or in the area, that we make sure that those aren't spread amongst our patients as well, like influenza. So we design protocols around that as well.
And do you work at the Ruth M. Rothstein Core Center as well?
I do. So I work at the Core Center where I have a very large HIV clinic, and I really enjoy doing that.
Nice. Okay, so summer is wrapping up quickly. When should people start thinking about getting the flu shot?
Yeah, you know, I'm glad you asked me that because it is ramping up, and it's almost fall. So the thing about when to get the flu shot is we never know when the flu season is going to be. So we don't know if it's going to peak in January or February, but what we do know is from many years that it generally peaks from December until February. And so the recommendation is to get a vaccine by the end of October.
Okay.
So we really could get vaccines at, you know, a patient's next visit to the healthcare worker up until, but we really want people to get their vaccine by the end of October. It's kind of a fine line between, we don't want to give vaccines too early because one's immunity can wane, and so the vaccine effectiveness can decrease as the season progresses. But we also don't want to miss the opportunity for giving out a vaccine. So, you know, starting around now up until the end of October.
So if I were to get a vaccination in July for the flu, would that mean it's ineffective because that's too early?
That is too early. It
Okay.
doesn't necessarily mean it's ineffective, and it will still have some effectiveness throughout the season, but its effectiveness definitely wanes. And so if, you know, we can see flu all the way up until the following May. And so by that time, it's probably not going to be that effective.
Got ya. What ages of people should get vaccinated?
Right. So really, any person that's 6 months old or greater should get a vaccine every single year.
Okay. And where should people go to get a vaccination?
Right. So there are a lot of places where people can get their vaccinations at, you know, from wherever their primary care physician is. People can get vaccinated from retail pharmacies, and really, it's really pretty ubiquitous right now in terms of getting vaccinated. If people aren't sure where to get their vaccine, they should call their primary care provider and ask.
Can you get vaccine for free?
So, you know, I'm not sure where people can get vaccinated for free.
Okay.
Yeah.
And how many people get sick with the flu every single year?
So a lot of people get sick with the flu every single year. It's really a disease that we have to respect. I think that, you know, for many people who either haven't experienced the flu or haven't really seen the consequences of what the flu can do, one might not really recognize how serious it is. But so, for example, last year, which was a very heavy flu season, there were like 49 million people in the U.S. that we know had influenza, and that's just people who got reported. So it was clearly more than that. And then there were 79,000 people who died last year alone of influenza.
Was that last year or was that 2018?
2018.
Okay.
So, yeah, and in the last year's flu season, so those were numbers from last year's flu season, we saw just in children there were 130 deaths. So, many of these could have been preventable if people were vaccinated.
What would you say to moms who are scared to get their kids vaccinated because of myths that they've heard on the internet or read or what have you?
Yeah. That's a great question. Parents are so protective over their kids, and there's a lot of information about vaccines and should we get vaccines or not get vaccines and fear around vaccines. What I would say is this is a great time because we have accumulated more and more data. So what I would say is make a decision based on what we actually know. What are the facts? So a study came out not that long ago that showed that children who were vaccinated against influenza but still got the flu, because that can happen, were significantly less likely to die from influenza than children who got the flu and didn't get vaccinated. So to me, that's so powerful. It's saying you can help prevent your child from dying if they get influenza.
Is it possible to predict how widespread the flu will be year over year? Can you look at last year and say that last year was really bad, so this year will be bad, or does it not have any effect on each other?
It really doesn't, and that's why flu is so tricky. So we really have ups and downs from year to year. Last year was a particularly heavy year, and the year before that was even heavier. So, we really can't predict.
And what are some myths about the flu shot? I know we talked about how moms were afraid to get their child vaccinated. Are there any other ones around, or?
Yeah, there are a lot of myths. I hear it from friends and patients. I think the most common myth is that people think they can get influenza or flu from getting the shot. And the fact is that the flu vaccine that one gets with a needle, which is the vaccine that most patients get, or most people get, I should say, is a vaccine that has dead vaccine in it. And so it literally cannot give one influenza. And even the nasal spray, which has live vaccine in it, is what's called an attenuated or weakened virus, and that also can't give somebody the flu. So really, one absolutely cannot get the flu from flu vaccine. And there have been studies done where they gave people the flu vaccine and also gave people a vaccine with saline in it, so a placebo. And there really was no difference in side effects. Mostly people will get a sore arm, maybe some redness and some swelling, but that's really it. It's a very safe vaccine.
So what about the people that get a vaccine and still get the flu? Does that have to do with the type of flu, or were they just kind of immune to the vaccine? What does that mean?
Yeah. So that has to do with a number of things. One is we base every year's flu vaccine on what type of flu we saw the year before.
Okay.
Sometimes we have that right and sometimes we don't. So it's unpredictable what flu will be circulating this year. But we're basing it on what we saw last year. So this year's vaccine, there's what's called a trivalent and a quadrivalent. So the trivalent has two types of basically vaccine that helps for flu A and one for flu B. And the quadrivalent is two for flu A and two for flu B. So that's one thing, is there might be a flu strain that's not in the vaccine that we have. The other thing is that the vaccine itself is just not 100% effective at all. We just don't have that type of vaccine efficacy with the types of vaccine that we've been able to develop to date. So people still can get the flu. The good thing, though, is that even if somebody does get the flu, just like with children who are less likely to die, adults are less likely to be admitted to the hospital. They're less likely to go to an intensive care unit, even if they do go to the hospital, and are less likely to die. So it's always helpful to get the vaccine.
So since a vaccine isn't 100% effective, do you think that there will ever be a vaccine that is?
That's a good question.
Or rather, does the CDC see that?
Sure. We'll never have something that's 100%, but we'll definitely have vaccines that have higher vaccine efficacy. And hopefully there will be something called a universal vaccine, which will be a one-time vaccine like we get for measles, mumps, or, a 1 or 2 dose vaccine.
Right.
Something that we don't have to get every year. There are also things called adjuvants, which make the vaccine more efficacious. And so there's a lot of research on this, and we will have vaccines that are more efficacious for sure.
Nice. Is it possible to be allergic to the flu shot?
Absolutely. Just like people can be allergic to anything, aspirin, Tylenol, and people can be allergic to any number of the components of the flu vaccine. What people worry about is if they have an egg allergy, and that's why it used to be that we would ask people, are you allergic to eggs before you get, because it's propagated in eggs. Most of the vaccines, there are a couple that are not. And so what we've realized is that people who only get hives after eating eggs are able to take the vaccine, and the recommendation is just to get the vaccine that's appropriate for that age and so forth, and that's fine. For people who have more serious allergic reactions like difficulty breathing, that sort of thing, the recommendation is still to get vaccinated, but one must get vaccinated in a medical center or some kind of a center where there is somebody who knows how to handle somebody with a severe allergic reaction.
Right. So if I were to have an allergic reaction, it was too severe to ever get the flu shot again, I'm basically SOL?
That's correct.
Okay.
That's correct. If you've had like a bad reaction to the flu vaccine, like an anaphylactic, yes,
okay,
then that's a contraindication to getting it.
And then what are the common flu symptoms and how do you treat them?
Yeah, so people generally know when they have what's called the flu. They might not know exactly what it is, but people feel so sick. So one thing is it comes on pretty suddenly. Headache, muscle ache, fever, runny nose, sore throat, cough. Those are the common things. But people feel pretty bad when they have it.
Looks like we have a caller. Caller, go ahead.
I'm just dying to know what this caller wants to say.
Hello.
Hi.
Hi. How can you tell the difference between the flu and a common cold?
Okay, so the caller asked, how can one tell the difference between the flu and a common cold? Which is a great question because, one, there's treatment for the flu and there isn't for a common cold. So you want to know if you've got the flu or not. And there's subtle differences, but most people tend to sort of know. So with a cold, symptoms tend to come more gradually. You know how some people say 3 days coming, 3 days here, 3 days going for the cold? That's generally how it works. So, people start feeling sick, but with the flu, it tends to be very abrupt. Fever is much less common with a common cold as opposed to it's very common with influenza. Headache is common in both. Muscle aches are also much less common with a common cold than with influenza, and those are sort of the big differentiating factors. One can have influenza without a fever, but it's much less likely.
Does that answer your question? Well, I think she hung up, so thank you so much for calling in today.
But,
No, keep going.
Yeah, you asked about treatment, though.
Yeah.
So once somebody, has the feeling that they have the cold, they may go see their healthcare worker, or the flu rather, and if they are diagnosed with influenza and the healthcare worker feels like they should get treated, we do have really good antiviral medications to treat influenza. So it is really important if one's feeling sick to call their provider and discuss this with them and whether they should come in and be seen, whether they should get treatment, because not everybody gets treatment. It's particularly important for the very young, like 5 and younger, particularly 2 and younger, 50 and older, particularly older than 65, pregnant women, and people with other health conditions like diabetes, heart disease, asthma. So it's just important to know that there is therapy out there.
Okay, so if I have the flu
Yeah.
and I don't feel like it's bad enough for medical attention and I just want to take care of it myself, what do I do?
Yeah, so if you don't have any other medical conditions and you're feeling, terrible, but like you're feeling okay, you're not short of breath, things like that, really it's all the stuff that we've heard about. Take things to bring your fever down, things that will help your pain, like nonsteroidal anti-inflammatories, or Tylenol, and drink plenty of fluid because people do tend to get dehydrated because of their fever. And really rest. Fatigue is a real common thing too. People feel a lot of fatigue. And really understand that the symptoms can last for quite a while. Yeah.
And so since I'm a pretty healthy person, if I am sick for how many days, would then I should go to a doctor or something?
Yeah, absolutely. So easily people are sick for a week. But by that time, you should be able to feel like you can get up and go around, get around. And even people can be are most infectious like days 3 and 4, but by a week, people tend to not be infectious anymore. They can be infectious for up to that time. So if you're not feeling like you're ready to get up and at least do simple tasks or maybe even go back to school or work, then I would think about calling your healthcare provider.
What kind of advice would you give to somebody that's been sick for 4 days and used all of their sick days and has to go to work?
Yeah, so that type of person, again, your most infectious days, really 3 to 4, and you don't want to infect anybody else, and really they probably would have to be evaluated by their employee health service,
Okay. And what types of complications of the flu have you seen?
We've seen a lot of complications. Again, it's so important to get vaccinated so we don't see these complications. But things like pneumonia, asthma exacerbations of other chronic illnesses like heart disease, kidney disease, diabetes, of course hospitalizations, intensive care unit stays, and death. So we've really seen the gamut. Other complications that people may experience are sinus infections and ear infections. So one really has to, just be careful, really be cognizant of these things.
And I'm sure a lot of these cases spread from family to family because everyone's so close.
Absolutely.
So what would you say to people that are caring for small children if they're sick?
Yeah. So first of all, anybody who's around small children absolutely needs to get vaccinated to protect. That's another reason to get vaccinated is to protect those who are more vulnerable around you. And really staying away from anybody who's vulnerable. In general, if one is sick with flu, should not go to work, should not go to school, should not be around vulnerable people.
Okay. And so if I had a child and I was really sick and I didn't want to give it to my child, what should I do?
Right. So it's tough. We have to weigh common sense with, and just what's practical.
Yeah.
But really, first of all, hopefully, if the child's older than 6 months, they've been vaccinated, so they have some protection. But really, keeping a distance as much as possible and excellent hand hygiene, covering a cough. Yeah.
And then are there any other groups that are considered to be high risk aside from really, really young and the elderly?
Yeah, so pregnant women, people with chronic medical conditions, asthma, heart disease, and lung disease, diabetes.
And then what's the best way to prevent seasonal flu, aside from getting a flu shot?
You don't want to hear me say that more time.
Is there anything else that people can do? Because know that there's a lot of skeptics. And like we said, you can still get the flu even if you have a flu shot just because it might be a different strain. So is there any other advice that you can give?
Yeah, stay away from sick people. Seriously, keeping a distance from people who are sick, not sharing things like drinks, cigarettes, that sort of thing, swapping of saliva. Staying home if you're starting to feel sick, obviously then you're already sick, but excellent hand hygiene, keeping some alcohol gel in your pocket, cleaning your hands before you eat, all of those sorts of things.
And is alcohol gel as effective as hand washing?
It is.
It is?
It is, absolutely. So it's not good if one's hands are dirty. It's not going to help with that. So then you have to wash your hands. But in terms of getting rid of the virus, getting rid of germs, it's absolutely as effective.
Is there anything that people can do? Because obviously in Chicago there are so many people, and a lot of us take the CTA to work. What do you do if the people next to you are coughing and they're just coughing all over and you feel like it's getting on you, but you can't really move? Like, can you say something to them, or is it just...
Yeah, what's the social etiquette?
Yeah.
You know, I think that it depends on the situation, but one might say, do you mind covering your cough?
Okay.
Or here's a tissue. Do you mind covering your cough with a tissue?
Maybe bring
some
hand
hygiene. Here, I have an extra one. Here's one for you. That's something I would do that my kids would be horrified of. Yeah.
That's awesome.
Yeah.
So is there anything else you would like to add?
Again, really, I just think we really have to understand how serious influenza is and how easily it's spread. If one watches sort of a slow-mo image of somebody sneezing, for example, I mean, there are particles of virus that just go all over the place. So one, it's and also just, again, sharing things and, not having good hand hygiene. And so it's relatively infectious, and it can cause very, very serious disease, and it causes a lot of death that can be prevented. So I think we really have to respect this disease. And the more people who get vaccinated, the less flu there is going to be to go around in general. So we just really have to take it seriously. And also, I do want to say that if one, as I mentioned earlier, but if you are sick and you want to, you are worried, one is worried, go see a provider, because there are good medications for it. The medication should ideally be taken as soon as possible, preferably within the first 2 days of symptoms. So go early rather than late, or call one's provider. And also think about, sort of alarm symptoms, especially a parent who's taking care of a child. If they see their child who's like breathing really quickly, having trouble breathing, if they note that their lips are blue or their lungs are retracted. I know, that would be really scary.
I didn't know that your lips could get blue from that.
Yeah, from not having enough oxygen.
Okay.
So they're not getting enough oxygen in. And they have such little reserve that can happen. So that is urgent. Those kids need to go to the emergency room right away. And for adults, again, having persistent problems, difficulty breathing, or persistent chest pain, having, of course, a seizure or something like that, make sure that the people around you are aware of sort of these signs to look for.
Awesome. Well, thank you so much for joining us. I hope that everyone learned something today. I know that I'm going to get my flu shot as soon as possible, and I'm sure you are too.
Oh, absolutely.
Well, everyone have a good evening. Thanks again.